I just want to say I want to thank everyone for taking time out of your busy schedules this evening to participate in this conference call. We're going to try to update everyone on what's going on, what's taking place in town. We've come a long way since the pandemic started, and I'd like to say I'm just very proud of how our leaders responded to the coronavirus on a federal level, state level, county and local level. And I truly appreciate the cooperation received from our residents to our workforce and really making the sacrifices necessary to keep Teaneck safe. I have a few other things that I'm going to add this evening and questions I'm going to answer, but I'll do that a little later in the program. Several of our guests this evening have other commitments, and I'm so happy that they took the time out. And I want to recognize all of them and allow them to speak first. Before I turn the program over to Teaneck Mayor Dr. James Dunleavy, just please let me take a minute to recognize the following individuals here this evening, all of whom are terrific supporters of the Teaneck community and who stood by my office during the pandemic. And, of course, Congressman Josh Gottheimer, I believe, is calling in from the Washington, D.C. area this evening. Thank you, Congressman. We have Deborah Kornavaca, the Deputy Chief of Staff, the Governor Phil Murphy, and Deborah's been a staunch supporter of Teaneck, and anytime I've asked her to come on board for any sort of program, she's always made herself available. Thank you, Deborah. We have Mike Marin, the President and CEO of Holy Name Medical Center. And Mike, many thanks to you and your staff for getting this community through the pandemic. You've always been there for me, for the town, and I appreciate all of your hard work and efforts. And many thanks to you. I believe we're going to have Dr. Adam Jarrett, the Executive Vice President and Chief Medical Officer at Holy Name Medical Center, who was very instrumental in medical initiatives that got Holy Name Medical Center through this crisis. So hopefully we'll see him come on board in a few minutes. We also have Teaneck School Superintendent, Dr. Christopher Irving. And Dr. Irving, it's been a tough few months, but you've done a great job for our Teaneck students in managing the curriculum online, and we look forward to hearing from you a little bit later. We have Teaneck Health Officer Ken Catter, who has worked very hard from the onset of the crisis to provide guidance and direction to the Teaneck community. And, of course, our past and present council members, to include former Mayor Mohammed Hamiduddin and former council member Dr. Henry Pruitt, and our current mayor, of course, Dr. James Dunleavy, deputy mayors Ellie Katz and Mark Schwartz, council members Keith Kaplan, Javon Romney Rice, Karen Organ, and Michael Pagan. And a special thanks to Township Attorney John Shadanian for his continued help to my office during the pandemic. So at this time, let me turn the program over to Mayor Jim Dunleavy, and we can get Congressman Gottheimer on board right away. Jim?
Great. Thank you, Dean, and good evening, everybody. There will be a number of things that I want to say and be asking some questions of our guests this evening. But first, I want to introduce the 5th District's Congressman Gottheimer. Josh has been a staunch supporter of this town and a staunch supporter of whatever we've needed to help us get through this pandemic. So, Congressman, if you'd like to say a few words.
Thank you, Mayor, and thank you for your remarkable leadership. And frankly, the entire town has just done an incredible job from day one. And as everyone knows, you all got hit very hard and very early. We've just got phenomenal frontline healthcare workers and hospitals. And Mike, thank you so much and for what you've done in town. But I hope everyone understands how blessed we are to have such great leadership through this challenge. And I want to thank, of course, the deputy mayors and the councilmen and women. Thank you so much for what you do, and the school superintendent and everybody, Dr. Jared and everybody. So I may just, if it's okay, give you a very quick update. I'm in Washington. We're working, among other things, right now on the next COVID package, which is critically important to Teaneck and to New Jersey and to the district. We've made incredible progress thanks to all of you who've done so much and made so many sacrifices, and both through the health crisis and through the economic crisis. And our numbers in New Jersey, as you know, have really come down. But we lost a lot of friends and family members, and more than 3,600, and more than about 40,000 cases that we know of. But the numbers now are much better, and if you talk to the hospitals, as I have, we've made just incredible progress. But we know that we're facing could be a tough fall, and we see what's going on in the rest of the country, so we need to be prepared. The virus has left behind a huge hole in our budgets in the state, somewhere between $15 to $20 billion, not to mention what it's done to many of our communities, including Teaneck, which I'm very proud to represent. And I'll tell you, there's a couple areas that we're going to be pushing for in this next package. One, for resources for all of our communities and for our state and local governments to help fill the budget gaps and shortfalls because of the virus. We're going to be pushing very hard for a second round of PPP loans that with great transparency and oversight. Those are our small business loans, key to our jobs, which I think are essential. Pushing very hard now also for more resources for our hospitals, who are just not getting back a lot of the patients for elective surgeries because people, are still scared. As Dr. Jared said to me just today, the hospital is the safest they've ever been. But I know a lot of people are concerned about showing up, and so that's having a big economic impact on our hospitals, not to mention what it costs them to help save a lot of lives and a lot of people. So we've got to think through things. We've got Becton Dickinson right in our district in Franklin Lakes, and they're working on things like needles and syringes and tests and more tests, because we've got to get more tests. Right now, the number, we're back to 7 to 10 days for results if you're not in the hospital, if you go to outside the hospital, and that is frankly, and a shortage of the chemicals needed to produce these results. And that's a huge challenge for us if we're going to get people back to school and back to work. We need to have much quicker testing and more of it. Listen, the good news is we're making progress every day on palliative care and other forms of care that are really helping help people through this process and through the virus. But as we work toward a vaccine, but it could be, we know it could be a while. I mean, I'm very optimistic with how great our R&D is in the state of New Jersey and around the world and in our country. But this virus is not going to get cured overnight, and we need to make sure that we're prepared with our supply chain and everything else to be ready for it. So anyway, thank you so much for what you've done in Teaneck. Mayor, thank you for your leadership and those who've come before you, and town administrator has done a phenomenal job. So thank you. My door is very much open, and I always want us to get back to work and back to life safely. But we got to keep doing what we've been doing, which is being really smart. And I just want to thank you all for your cooperation, working so hard, the unity you've shown as a community. I know if we work together in the greatest country, our best days will be ahead. But I know it takes a lot of hard work. So thank you, and God bless everyone.
Thank you, Congressman. And again, we appreciate your support in Washington for everything that we need here in New Jersey and in the 5th District. At this point, I want to introduce Deborah Kornavaca, the Deputy Chief of Staff to Governor Murphy. Deborah?
Thank you so much, Dean, and thank you to all of you who are taking the time out to join this evening, to the Mayor, Council, to your entire phenomenal team in Teaneck, to the Superintendent of Schools, and most importantly to all of these community members who have joined you this evening, who have taken so much time to stay in touch, to be supportive, to show so much unity and strength, courage and support throughout all of this. And a special shout out to your healthcare workers, Mike and your team, and all of the healthcare workers who live and work in Teaneck and the county. You have been lifesavers in ways that we will never be able to repay you, and we are so grateful. I bring you greetings from Governor Murphy this evening, who is with you in spirit, who is working hard to make sure that our state gets back on the road to a recovery that protects public health and gets back to economic health as well. And with that, I want to thank the congressman who may have already had to leave the call, but for the phenomenal support of our delegation in Washington to get us the direct support we need. We know that the work that they're doing is also saving lives, and we couldn't do it without you. We still have one more major hurdle to get through in Washington, but we know that our delegation is there fighting for us, and we are so grateful. I reflected on the first time I joined a Teaneck call. It was the beginning of March. My daughter had just finished her musical in middle school, and I stepped outside to join this call. And I think it was probably the last night of normalcy that I had since then. And I'm sure all of you look back into early March and wonder where that world went. But what I can say is that we are working very hard, all of us together, and it's been shown in the success that the state has had in slowing down the spread of the virus, to get back to a world that we knew, but we're only going to do it in a way that is slow and judicious, and that makes it so that we're not experiencing some of the very scary things that, as the Congressman referred to, are happening in other states. I'll touch on 5 topics very briefly this evening. I don't want to take up too much of your time, but wanted to bring you some updates. First, around reopening. As hard as closing down was, reopening is in many ways harder, because we are committed to doing it in a way that protects public health, that allows our businesses to get back up on our feet, and some sense of normalcy in the world around us. And with this virus the way it is, it's very hard to know how to do that correctly. We're guided by the data. The data doesn't provide us clear markers or answers, but what it does is it gives us trends and directions. And so we make every decision based first and foremost on public health, and then how can we achieve the economic health based on where we are at with public health. We know it can be slow and hurt and really causing economic stress for so many families and businesses, but we also know that our first and foremost priority has to be public health. And we know that for many, they're scared as we go back into reopening. But what we do know is these common sense pieces of wearing a mask, of keeping social distance, of washing our hands, of staying home when we're not feeling well, of accessing the abundance of testing that is available will help protect ourselves, our loved ones, our families, and our communities. So we ask you to bear with us as we slow down reopening a little bit to make sure that we're not doing it in a way that leads to dangerous spikes that would force us to pull back and reverse. We ask you always to feel free to reach out with questions and comments and concerns, because your input does help inform good decision making. And we ask you to look around at what's happening in some of the other states and know that if any day you're feeling frustrated that we're not doing more, we're doing it to protect public health. Second, I want to touch briefly on testing. As the Congressman said, there are some labs which are getting backed up because there are a lot of states flooding the testing labs. In our state, we are running between 20 and 30,000 tests a day. We're collecting that many samples, which is good, but we have the capacity to take in more tests. Rutgers University, the proud developer of the saliva test, has that capacity to run tests in short turnaround, and we're working with the labs to make sure that they're prioritizing the tests of our New Jerseyans who are taking the test. There is a lot of community-based testing. I know that Interfaith Urgent Care, whom we partner with, has been to Teaneck. They're working at putting testing sites in churches and mosques and synagogues and community centers and trusted places that are convenient for people to get to, so that it's an easy step to do. We want to take away the fear. We want to take away any stigma. We want us all to realize that getting tested is something that we can just do on a regular basis if it's necessary for our health and for public health. So we encourage you to pay attention to where those testing sites are and not be afraid to take advantage of the opportunity to get tested. As well, many of our partners in the pharmaceutical world, CVS's and Rite Aids, have testing sites, and the governor's office will continue to partner and support with community-based testing wherever we can. Next point is on contact tracing. Testing is the first step to making sure that you are healthy and that your family and friends and community are healthy, but effective contact tracing is essential to stopping the spread of the virus. And so we have a contact tracing cord which is forming around New Jersey, working in collaboration with our county health departments and our local health departments, ensuring that they all have trained staff ready and able to do the contact tracing that the positive tests demand. We're working on a common database platform, ComCare, which means that everybody across the state is able to look at the same data, ask the same questions, and collect data in a uniform way, which is critical to us being able to evaluate the progress that we're making in controlling the virus. And we're partnering with the Rutgers University School of Public Health that has already given us 150 of their highly trained graduates from the School of Public Health as trained contact tracers into the field. And I think it's tomorrow or today, they're graduating another class of 150 from the 18-hour course, and they will also be deployed. So we're continuing to hire contact tracers, deploy them where they are needed around the state, making sure that we're building capacity. There will be a media campaign starting next week around contact tracing and testing. You'll see billboards, I hope. You'll see it in public transit. You'll see it on social media and other spaces. And this will be material that you can also lift and share. We'll be having a toolkit for municipalities and counties because we really need to help spread the word and let people know that when we get tested together, when we trace together, we will thrive together. Next, very briefly, and I know your superintendent will talk more about it, the opening of public schools is probably one of the toughest things that we're having to tackle to figure out how to do it in a way that allows our children a safe and healthy environment with which to re-engage with their education. And our goal has been to provide the districts with the flexibility needed to make the decisions that suit the community best. The first step that we took was announcing a huge investment in closing the digital divide because we expect that every student will have some part of their education is distant learning, and we want to make sure that every child has a device and has access to internet. The second thing is that we are encouraging the restart committees at the local level to make the decisions that are best for your community. And I know that your superintendent is working hard at doing that in collaboration with educators, with community members, with parents and professionals. We have announced we wanted to make it very clear that if parents feel the best option for their child is to do only remote learning, that is an option available to students, and in many ways it may help relieve the pressure on the physical space of the school buildings so that more children who need the space can come in and take advantage of that. And I know districts are working very hard at making sure that safe spaces are being provided for children who are doing distant learning but do not have guardian or care at home where they could remain safely to do the learning at home. There is a lot of work around public schools, and there are a lot of questions, and I'll be honest, there is a lot of fear. What we are working to do is to answer the questions as they come up. We're working with your superintendents, with your parents, with the labor unions on a regular daily basis to answer these questions. And if we don't have the answer, we try to figure it out together. There is no roadmap for this. We're making this one up together, and together we will figure out what is best for our students, and we will always be guided first and foremost by the health and safety. And finally, I'll just end with the fact that, as the Congressman alluded to, there is a huge budget challenge that is created by what's happened through this virus. And we are working very hard with the legislature and deeply appreciative of the leadership in the Senate and the Assembly for the passage of the bonding bill. It does not make anybody feel good that we are in this crisis, but we know that ability to borrow some money to help close the budget gap will allow us to continue to fund essential state programs and services which are needed today as much as any. And we are working extremely hard through this budget process to make sure that we have an equity lens, that we look at what we're doing to make sure that we're closing the disparate impact around the virus on our communities of color, as well as on the economic access to capital and financial stability. So we will look forward to partnering with you. We know these times are fraught with challenges, with a lot of fear, and a lot of questions for which we do not have definite answers. But know that this administration and Governor Murphy are committed to working with you every step of the way. We are deeply honored to be partners with you, and we are incredibly inspired by Teaneck's commitment to working together, to all you have done to save lives, to protect your community, and not only that, while you were in the middle of the crisis, to be so generous in giving to all of those that you supported and helped along the way. So thank you for this opportunity this evening.
Deborah, thank you very much, and please thank the governor. And our hope is that whatever support the state can give us at the municipal level, we'll be very happy to take, because we know the times are going to be difficult ones and difficult decisions to be had in the future. So we thank you, and we look forward to partnering with you and the governor. Now, next we have up Mike Marin, CEO of Holy Name. And Mike, before I start, I do have a personal hello to give to you from my CEO, Gary Horan, down at Trinitas Regional. He sends his best. So, Mike, if you could, I think what would be important is to give our township just a little overview of the status of Holy Name right now, because we know what you've been through, and also what are the things that you're looking at as a medical center in terms of preparing yourself for perhaps another round or some other future event like this in the fall.
Sure. Well, thank you, Mayor. I appreciate the opportunity to address everybody. It's the first time I've actually done it, and I just want to take 1 second to thank everybody, starting with Governor Murphy, who's just been an incredible supporter of ours in the entire state. Congressman Gottheimer, who goes without question, has been incredible. But most specifically to you and former Mayor Hamaduddin and all the deputy mayors and the council, Dean, for the town manager. Your support through this thing has just been remarkable, greatly, greatly appreciated. I don't know you'll ever realize just how much. And then the residents of the town, the outcry of support and the was felt by everybody, from the clapping to all the other gestures of support that came through, means a lot, and it really helped the staff get through the toughest times. And so, to me, just a great, great testimonial to the town. And I also want to acknowledge the mayor and council and the former mayor for their bold leadership, because as far as I know, Teaneck was the first town to make some very tough decisions about shutting down and pushing for social distancing and quarantining and limiting access. And even at this stage, given all we've learned and known, that is still the only real weapon we have. The only way we know that we can mitigate, and I just want to remind everybody, there are no absolutes with this virus, and the only way we can reduce risk is by doing the things that we've done, and all evidence suggests that it has worked. And so that bold move from Governor Murphy right on down to the council, what you guys have done, do not underestimate the tens of thousands of lives that you saved by doing it. Tough decisions, a lot of backlash. I know that. It hurt the economy. It's just very, very difficult. We're not built to be locked down the way we were, but it absolutely was beneficial. So Holy Name now is down to very, very few patients. In fact, for a week there, we had 0. There's only 4 in the hospital now, and those are outside the region. So because of the clinical trials that we have access to and sort of the reputation with the media attention that we gain, we have people eager to transfer in to access those trials. And so the patients that we see today are coming from outside. We are very, very minimal, sporadic as we're testing for people coming in. Every patient who comes to the hospital for a procedure, any procedure, is being pre-screened. And so we're getting some positives there, but they're unlike the ones that we saw back in March and April. They're not symptomatic. They're not in any kind of real respiratory distress. And so there were a few of those cropping up, but very, very small numbers. And so, as everybody knows, the volume has absolutely been diminished. That said, all the things that we did in the midst of the virus, the building of the negative pressure rooms, you can still see the tubes hanging from the windows around the hospital. So negative pressure is a big, big component of it. All the additional ICU space that we built, we went from 20 critical care beds to 120 critical care beds. All of that resource we're keeping in place. It's sitting idle right now, most of it, but we're not going to take it down until we know that we have this thing beat. So we have now physical space capacity to be much quicker in our response than we were back in March and April. We're also stockpiling all of our PPE, so we're increasing our supplies of all the necessary equipment. The ventilators, the monitors, all the other components that we had to sort of scramble to get in March and April, we're holding on to those. Those are with us, and so we're in a much better position going forward from a resource standpoint. We've talked about, Deborah and Congressman talked about the testing. We actually have the ability now on 4 different instruments to run the molecular testing. We also have the ability to run the serology testing. That's to see if you have the antibodies. And so we've been doing those. We have 4 different instruments so that we can try to get 4 different supply chains on the reagents, which are the chemicals that have been challenging to get and being consumed around the country in mass amounts. But that gives us much more flexibility, and we continue to explore and stay on top of the testing because the advancements in the biotech world in terms of turning that around are moving very, very rapidly, more rapidly than we've seen in the last 2-3 decades in any area. And so that's encouraging to see the effort and the focus in improving both the diagnostics and the understanding of the virus so that we have ample response to it going forward. We're screening everybody now when you come into the hospital. As Dr. Gottheimer said in his earlier call this morning with Dr. Jarrett, the hospital is definitely much safer now. It's one of the safer places to be. I feel more comfortable and safe within the hospital than I would say in the supermarket or any of the other places that have opened up because we're so focused on this. The entire hospital has been cleaned thoroughly. We have UV lighting and all sorts of other mechanisms to terminally clean if there was any exposure. The staff are all wearing masks. We have our PPE. We're encouraging all visitors who enter have to wear a mask. We're limiting them still. We have technology where you walk in and everybody gets a thermal scan. They'll get a facial read to see if you have a mask on. So we're using our technological capabilities to facilitate that moving forward. And I think the most important thing is we're building a network of surveillance. So the cooperation with the other hospitals around the state, from Atlantic Health to Valley and Englewood, Hackensack, we're all sharing information now on a greater basis. And so our ability to have a more accurate finger on the pulse of the community from a surveillance perspective, to know if there is all of a sudden a creeping up of the virus in the community, we're going to know a lot sooner now than we did back in March when it first came. And so we'll be able to respond and to be able to sound the alarms quicker that we have to go back to, unfortunately, for this round and for the rest of this year, and until there is a vaccine or an antiviral targeted therapy for the virus, the only thing that we're going to be able to do is then sound these community alarms to say, all right, we got to go back to very aggressive social distancing and shutting down to make sure that that's there. And the only other thing that I'd like to encourage everybody, we do this at the hospital. I encourage everybody, masks are important. They absolutely help. They mitigate. And a reminder, the mask is for you to protect everybody else from you. It doesn't really protect you so much from them. But if everybody does it, because we don't know where the virus is, it works. But still the most important hygiene component is washing your hands. So make sure that you keep that Purell in your car, keep it with you in your homes, at your office, wherever you are, and use it frequently because hand hygiene is by far the most important component of this, and we just have a tendency not to emphasize that enough. So Mayor, we're ready if the surge comes back. We don't know. All the epidemiological models are sort of in conflict now. There's a lot about this virus we still do not know. It clearly is not a seasonal virus because it's rampant right now in the southern states, in Florida and Texas, California, Arizona. Those are the daylight hours are long. There's extra exposure to UV. The humidity is high, so droplets should be hitting the ground faster. That's all the science behind that. So we just don't know. And so we got to be prepared and we got to anticipate. But we are much more ready and much more prepared for another go-around to be responsive to the community should we need to do so.
Mike, thank you very much. And again, thank you and your staff for everything that you did for the people of Teaneck and for the people of the surrounding areas. There are people alive today because of your efforts, and we appreciate it very much. Thank you.
Thank you.
Next, Dr. Adam Jarrett, Executive VP and Chief Medical Officer of Holy Name. Dr. Jarrett, do you want to say a few words, and then I think I have a question or two for you?
Sure. So, I'll reemphasize a little bit of what Mike said, that, unfortunately, we still don't have a definitive treatment for coronavirus. What we do have is the beginnings of some medications that we know have some impact. And there's recent studies and there's more studies going on. In fact, Holy Name has seven different studies looking at different treatments for coronavirus patients, including studies of patients who are just exposed to the virus but do not have the virus. So these types of studies are crucial in terms of ultimately trying to get a definitive treatment for coronavirus. But unfortunately, we still do not have that definitive treatment. That being said and done, that is why it is so crucial that we follow the advice of the leadership of Teaneck and all of New Jersey. We need to wear masks. Masks, as Mike said, protect the people you're around a lot more than they protect you. We need to socially distance. We need to avoid gathering in large groups. We really need to continue to understand that we could very easily have another surge, especially with what's going on in the rest of the country. I do think that it is time to begin opening up, as we've begun to do, but to do it in a very controlled way, and to make sure that as we're opening up, we do it slowly and we watch whether or not there are outbreaks in the community. And I do think we do need to be prepared for the possibility that as we open up, we will begin to see more cases and may have to pull back the opening up. I can't thank the leadership of Teaneck enough. I truly believe, as Mike said, that the leadership of Teaneck really, in acting swiftly, and really, I think far swifter than almost anyone else in the entire country, saved lives. I have no doubt in my mind that by closing down early, we were able to decrease the peak of the impact on the Teaneck community, on the community of Teaneck, and really probably all of Bergen County. So we have to keep in mind, as Mike said, that our only foolproof method to treat this disease is to prevent it. And the only way we know how to do that is with masks and social distancing. And we need to be very careful about opening up and do it in a very cautious, controlled way, as New Jersey has been doing. I think the governor's been doing an excellent job making the right decisions about how to open up, and he's clearly watching very carefully and at times slowing down that opening up. And I think we just need to continue to do that. I can tell you, as Mike said, we are absolutely ready in Holy Name. If there is a second wave, we all are crossing our fingers and hoping that there's not, but we are ready. We are stockpiling PPE. We, at present, have a good supply of testing, although we are continuing to look for more testing. And we are in communication with the other hospitals in Bergen County so we can all work together. And we're ready. We are hopeful that there won't be that next surge, but we certainly cannot count on that.
Thank you, Dr. Jarrett. Dr. Jarrett, I know I get a lot of questions, the patients that I see in rehab, with respect to antibodies and antibody testing. And I know some of my patients have come in and said to me, I'm fine, I have antibodies, I'm safe. Could you briefly discuss really the current status of really what is being tested here and what this information means to the public when they do get an antibody test?
Yeah, absolutely. As Mike mentioned earlier, as with much of this virus, we still don't know and we are still learning. We do have the ability to test for antibodies now. We're doing that at Holy Name. And people can and should get their antibodies tested, but the results of your antibody test, whether it's positive or negative, really can't change your behavior in terms of your need to socially distance and wear masks. We think, but we don't know for sure, that having positive antibodies offers some level of resistance. There's good reason to believe that, but we just don't know for sure. We unfortunately are beginning to see people who had antibodies, and those antibodies are dissipating. We've seen lots of patients, unfortunately, who had antibodies, and now the antibodies are gone. We don't 100% know what that means. It is concerning that if you lose your antibodies, then you may be more susceptible to the disease. But we also don't know, even if you have antibodies, you could be somewhat susceptible. And there's also the possibility that there are either other antibodies or other levels of immunity that people may obtain that we can't test for. So testing for antibodies is important. It's really more important because it's helping us learn. It's really not important in terms of the impact on the individual patient. I do recommend people get tested, but I don't recommend that they change their behavior based on their results.
Great. Thank you very much. And I think Mike mentioned it earlier. I think it's important to note that we have seen people who have tested COVID positive, but have had virtually no symptoms. But they also could potentially be a vector for the disease if they don't quarantine themselves at least for 14 days. Is that correct?
Yeah, and that's one of the things we're learning about this virus. There seems to be a significant component of asymptomatic spread, which is concerning, and it is very likely why we are having the problem that we are having. I think there are a significant number of people who had this virus and are infectious and just don't know it. And that's concerning, and that's why we cannot rely on either the results of your antigen test, results of your antibody test in terms of people's behavior. We kind of all have to walk around like we're infected. That doesn't mean that you have to quarantine anymore. Certainly we are quarantining people that we are known are infected. But we all need to wear masks and socially distance because people could be getting reinfected and not know about it. And people could be infected for the first time and not know about it. And the only way that we are going to prevent another surge is to make sure that we continue to socially distance and continue to wear masks and then wait for that vaccine. And we need to learn more about that vaccine, but that's going to be the real way that we can resume to some level of normalcy.
Great. Thank you very much, Dr. Jarrett. We will certainly be in touch with you as we go through this, especially if we start to have an uptick. We will need your guidance and your knowledge to help us through if, God forbid, we have another phase. Thank you very much.
It's really been a privilege, and I'm just so proud to be in Teaneck, see how quickly Teaneck acted.
Thank you. Our next speaker this evening is Dr. Christopher Irving, who is the superintendent of Teaneck Public Schools. I know that he is deep in process and planning and trying to put together what the plans will be for the fall, and I know he still has to meet with his Board of Education with regards to this, but we did want him to come this evening and say a few words from his perspective on what he sees happening from the education arena. So, Dr. Irving, the floor is yours. Dr. Irving, are you there?
Hang on, let me just make sure he's not muted here, Jim. Bear with me 1 second. Okay. Yes, I think he is muted. So let me unmute him.
Okay.
Okay.
Can you hear me now?
Irving, you there? Okay, good. We got you.
I'm here.
Hey, Dr. Irving.
Thank you, sir. Hey, Mayor Dunleavy, how are you? Very good. Thank you. I kind of went through a 30-second spiel and realized no one heard me. So I'll go back and just say, first off, thank you for inviting us to be a part of this conversation. It's an important conversation as we move forward. And I was saying a second ago, I appreciate Deborah's sentiment from the governor's office because Deb knows, working firsthand in the governor's office, what this process is and has been like, talking about the return to school, and it is literally very much trying to fit a square peg in a round hole, and we are doing our best to plan while still get feedback from parents, teachers, community members, other stakeholders. And ultimately presenting that plan before the Board of Education. And I want to just thank the board for their leadership in providing the guidance and the support that our administrative team needs to be able to put together a model or a series of models in place that do several things. And while I'm not going to get into details tonight, that will be shared on the 29th of July at our board meeting at 7 o'clock. I will tell you
our priority is to ensure that no matter what educational model we go through or we embark upon, that it is academically rigorous. It involves, a high level of teacher and student interaction, either live virtually or live in person or hybrid in person to some degree. And even if a family opts, as Deborah shared, to go fully virtually, there will be some live, person-to-person interaction. As we work through that process, though, that's going to be really what the month of August is going to look like. And so once we propose a model on the 29th, there will be, I'm sure, a series of questions from our board. We have a board subcommittee that's being led by Trustee Gerald Reiner. He's our chair for the, Return to Schools, subcommittee that our board president commissioned to put together. And, we are working diligently to make sure that they are comfortable with the plan. And they'll be meeting on the 27th. And then there will be a board meeting, as I indicated, on the 29th. We also understand that there is a holiday for those who are observant on the evening or sundown the 29th. Because of that, I'll be releasing a pre-recorded recording of my presentation on the 28th. So for those who maybe can't tune in live, you can actually get a sneak peek of the presentation recorded on the evening of the 28th to be able to view as well. After the 29th, to be very frank with everyone, the real work begins. And it really is around coordinating and ensuring that all our kids have the devices necessary to move forward for next year. As you all know, we went one-to-one in our middle and high school, I think my first year that I came into Teaneck. And then last year, we ensured that every single student had or has a Chromebook and a wireless device to be able to connect to the Internet. We'll be working with parents to ensure that those devices are working. And if they're not, they'll have an opportunity to exchange those devices and return them for new devices for that matter. Just acknowledging that no matter what happens, if we need to go back fully virtual, we want to make sure that our students are prepared and our teachers are prepared as we move forward. But as everyone can imagine, I talked about the square peg and a round hole analogy. Safety is paramount, and it is, while a rigorous educational experience is absolutely the priority from my lips to your ears, I would be lying to you if I didn't say that we as most superintendents, we have, concerns, relative to ensuring that we provide as many safe avenues and mechanisms in place to be able to keep our kids and our teachers and our parents safe. And so we are working, with the state, our county, the local township, with regard to our health, measures and what we will have. We'll be providing, at the beginning of the year, a starter pack for PPE for each child and each teacher. As we move forward, there'll be robust cleaning and, sanitizing of the building on a daily basis. That is actually happening now as we prepare ourselves as we move forward. But we recognize that, keeping the safety and the confidence of our families is going to be critical. And if our parents don't believe that we have our stuff together to be able to keep their children safe, I know parents will possibly opt out. And so on the 29th, we're going to talk through exactly what that will look like, what a socially distant classroom will be. There will be a series of videos that we're going to record in which we're going to show you exactly what the classroom setup will be at all the respective grade levels. We are going to do everything we can to earn and demonstrate that as a district we are prepared and ready to be able to open schools in a safe and equitable learning environment. And let me be clear, that's not going to be easy, but we are committed to making it happen. The board is fully committed to seeing this through and making sure that no matter what instructional model we have, it is indeed one that takes into account the quality of our education first and the safety of all parents, students, teachers, close second or even close first for that matter. So, that's where we are. I invite everyone to join us on the 29th of July. It will be a Zoom meeting. After that date, there'll be a series of communications that parents are going to receive. If you are a parent who receives busing, what those protocols will be like. If you are a parent of a special needs student, if you're a teacher with a health condition, if you're a parent who has a student with a health condition, we are literally waiting until after the 29th to get the approval of the board, and then we'll be rolling out a series of forms, protocols, procedures, new policies, and what I ask from everyone is just your patience, but also your honesty as we roll it through. And if there is something that we're missing, if there's a blind spot, because as all of you can imagine, Deborah said it, and I appreciate the sentiment that we're planning this every single day, and every single day something changes, and that's what makes this process even more difficult. When we think we know something in reference to the virus, when we think we know something in reference to the return to schools, for good or for bad, it changes. And we are adapting to that. And so I want to be very transparent about the fact that the plan on the 29th may indeed change depending on the tenor of our country, the tenor of our state, and the directive of our governor and that of the Department of Education. So, thank you for having me on this evening. And I wanted to, thank the manager, Dean Kaczynski, again for the work that we've done together, to the point that several made. Teaneck was one of the first towns. We were one of the first towns in the county to close, and I know I took a lot of heat for that. But I think in hindsight, it has proven that was the right, decision to make. And there will be other tough decisions that we're going to make as a community. And I will just ask us to just remember that the decisions we're making are for all children, all parents, and all our teachers as we move forward.
Great. Thank you, Dr. Irving, and we look forward to your work with the Board of Education as you do everything you can to keep our children safe, but also get them well educated. Thank you very much.
Thanks, Mayor.
At this time, I'd like to ask Ken Cater, our Teaneck Health Officer, to share a few words and ideas with us. Ken?
Okay. Thank you, Mayor. Okay, so as of today, Teaneck has 1,108 residents that have tested positive since early March for coronavirus, 106 deaths due to coronavirus. So far, there have been 11,349 negative test results reported. So that puts the positive test rate at approximately 8.8% of those tested. We keep in mind that not every negative test finds its way into the system for whatever the reason, so that rate is certainly lower than the 8.8%. Teaneck jumped out quickly with positive cases back in March, and as time passed, all other municipalities have increased significantly, caught up with Teaneck in cases past Teaneck in the percentage rate infected by population. As of now, Teaneck is fifth in the county with a 2.7% rate of positive cases for population, total population tested. Total population overall. Of the 106 deaths reported, 44% were related to long-term care facilities. Of those 106 deaths, 51 were female and 55 were male, so based on gender, it's fairly balanced. 11 out of the 106 listed as Hispanic or Latino, 94 listed as non-Hispanic, non-Latino, and 1 listed as unknown. No further breakdown beyond that has been provided. The major majority of those who are deceased had underlying health issues. We've had a few test sites provided, including a program at Fairleigh Dickinson University parking lot back in May, and we've had 2 mobile test sites at the Rhoda Center as provided by the County of Bergen. The mobile test sites were attended by over 1,200 Bergen County residents. We also encourage everyone to go to Bergen Newbridge Medical Center at 230 East Ridgewood Avenue in Paramus. They should be contacted at 201-967-4000 to arrange for a test or to receive more information about testing. Over the past 6 to 7 weeks, Teaneck has averaged just over 1 positive case per day, which is very encouraging. During the peak back in March and April, we had 7 staff members working day and night, 7 days a week to investigate the fast-paced spread of the disease. We were able to reach out to all cases and attempt to contact all reported cases by May 6th, ahead of most, if not all, other municipalities. I now have 2 staff members dedicated to handling investigations as their primary function, and we have clearly flattened here in Teaneck, only having, like I said, just over a case per day. I have staff trained should we see a spike or second wave. Additionally, we are working with the county, as mentioned earlier, about all other Bergen County municipalities, coordinating all aspects of investigations. Should another agency become overburdened with a spike or need for support, as also mentioned about the additional contact tracers that are being hired by the state in each county to help with support. There were a number of questions that were forwarded to the town manager today, who he distributed them. So I'm just going to go over a few of them very briefly. With some of these were covered already. There was some question about antibody levels and their diminishing and whether or not you could get retested, and the answer is yes, you can. As Dr. Jarrett mentioned, we don't know the full efficiency of, knowing what your antibody levels are, the level of protection, but yes, you can get tested again. There was a question about masks, the ones with the valves, are they acceptable? According to the New Jersey Department of Health, they have not provided directive where you cannot wear them, but you should keep in mind that exhaled air may not necessarily be filtered, so probably a more appropriate mask would be one that allows for air to be trapped from going out and going right into a mask. Are face shields effective? Face shields are really designed to cover those openings, especially that are vulnerable, like eyes, where a mask can't protect them. Worn in conjunction with a facial mask is more ideal, but at minimum, a facial mask covering the airways is definitely, at minimum, the route to go. What about businesses that have employees or customers that refuse to wear masks? Under Governor Murphy's order, masks are required when dealing with customers in public. If you see a violation, contact community police. You could also contact the health department. This is, followed up by the police for enforcement purposes. We will contact the business. We will go there if we have to, and see what the issue is there. The one condition is that if somebody has a health issue where they cannot wear a mask, they are free from wearing that mask. We could require a doctor's note for that. Due to HIPAA requirements and regulations, we can't ask what their illness is, but we can require that if they're not going to wear a mask, that they do provide us with some sort of doctor's release from wearing it. When will certain township facilities reopen, such as the library, the senior center? Perhaps the township manager may want to answer those. Most of this is tied into the governor's executive orders, so we're really going at that pace. 2 more items. Indoor gatherings for celebrations. Right now, you could have outdoor gatherings for up to 500 people. Indoor gatherings for wedding ceremonies only can be the lower of 100 in number or 25% of the capacity of the facility. Again, that's for wedding ceremonies only, not receptions and no other celebrations. And finally, what are the precautions at dental offices? Dental offices are under the guidance and direction of the American Dental Association. Some requirements that they have to implement are pre-screening clients before arriving at the office, not having walk-ins, temperature readings upon arrival, mask worn in the office by patients unless seated at the time of service, and 15-plus minutes interval between clients so that they can sanitize the facility, the work area, so they're prepared for the next client coming in. The dentist must also wear appropriate personal protective equipment in accordance with the ADA, the American Dental Association. So that pretty much covers the questions. That brings you up to date with the statistics and where we're at, what we've done, and what we're prepared to do going forward. If there's any other questions that anybody has, feel free to email me and my staff at the health department at health@teanecknj.gov. Thank you for the time.
Ken, thank you very much for that update. I'll just start to close us here this evening with a couple of thoughts. First of all, there was another question that was submitted regarding what's the town doing in regards to any potential complaints that we receive regarding compliance. And I know, because I've spoke with Dean on more than a few occasions about this, that we are reviewing all of them. We are sending Teaneck Police out to review and to give warnings, and if necessary, more severe warnings, is to coin a phrase, in order to make sure that people stay safe. So I can assure you that whenever it was made, it's made known to us. We are responding, and we are checking out those complaints. I want to leave you this evening with this, Teaneck, and that is this. The numbers are so much better, obviously, than what they were. And thank goodness most of us made it through, at least this main pandemic, healthy. But we always have to remember the 106 that we have lost in the past 5 months. It is not a happy number to see. We've lost 106 of our friends, our neighbors, our relatives, and we always will keep them in our thoughts and our prayers. But I also want to leave you with the idea that this is not over. That I know patience is very, very hard to have as a person, especially during the summer when it's wonderful out and we want to go and we want to play and we want to be with our friends and our family. But you know what? Getting ill is much harder. And it's much harder on you. It's much harder on your family. It's much harder on your friends and acquaintances, because without knowing it, you may give it to them too. So please, please wear your masks where needed, and also keep the social distancing up, because that's what got us through. As you heard tonight, medicine is still trying to catch up with effective treatment and effective vaccines, but that's way down the road. And we're going to have to do our part to keep ourselves safe as well. So with that, Dean, do you have anything else to add?
Thanks, Mayor. I just want to say New Jersey has a great website for information on COVID-19. They call it the COVID Hub. It's covid19.nj.gov. Again, covid19.nj.gov. You can ask your questions from anything to everything, testing sites, facilities, symptom checker. So it really is a very resourceful web page. I had a question about, again, the municipal buildings. As everyone should know, we are back up and running. The municipal building is open. We've hired COVID ambassadors. Again, they monitor our doors to make sure people coming in are wearing masks, using the hand wash station, socially distancing, staying on the markers in place. We've put in and installed plexiglass barriers for our staff to protect them. We hired additional cleaning staff, and we have probably a good three-plus month supply of PPE on hand. The library, I received this question as well, Mayor. The library is just doing contactless door-side pickup of library materials to residents. They do have expanded hours. Building access is limited to the front desk only, one person at a time. I spoke with the library director today. He believes they may be able to expand upon that when some other safeguards are in place sometime the latter end of August or early September. Senior activities at the Rhoda Center, obviously, our senior population are the most vulnerable, so we're taking that very seriously. There are the executive order is in place that limits it to 25% occupancy, and we're not ready to, undertake the senior programs at this time. It's going to be a little bit. I can't give anyone a date. I don't know if it's going to take place in the fall or not. I'm working with Ms. Crockett, as everyone knows. There's a lot of construction going on at the Rhoda Center as well. So we're not ready to have any of the senior programs. We're working on it, and as I get some additional information, I will keep everyone posted. And again, I just want to thank our leaders, elected officials, the workforce, the residents. Everyone has been great, and without the cooperation, it would have made things much more difficult for me and to the governor's town. So again, thank you very much, everyone. And Mayor, I'll turn it back over to you.
Thank you, Dean. So I want to conclude the call by thanking everybody. Please have a safe, peaceful summer. If any other events or any other updates we feel are necessary, we will do other calls periodically as those events warrant. But until then, please know that our staff is there. You can contact them through the website. And again, have a safe summer. Have a good evening. And I look forward to seeing you around Teaneck. Have a good night.
Thanks, Ray. And this recording will be on the website tomorrow morning.
Thank you.
Okay.